Hi, my name is Brook Etherington with Alliance Recovery Centers, and some colleagues of mine and I are trying to produce some short videos that kind of address some issues surrounding opioid use disorder and medication-assisted treatment to help everyone better understand, again, the disease that is opioid use disorder and how medication-assisted treatment works to treat it. We've done a video on addiction versus dependence, and this is piggybacking off of that because distinguishing the difference between the two is critical in understanding opioid use disorder and specifically why medication-assisted treatment works to treat the disorder. Again, the concept of dependence in general means that our bodies only function normally in the presence of a substance, and we are dependent, all of us are dependent on many things, oxygen, food, water, insulin. If you take any of those away from us, our bodies become dysfunctional and ultimately we can die. But I'm going to talk to you specifically about what happens when someone becomes dependent on an opioid. So there is an area at the base of your brain called the locus coeruleus. And the locus coeruleus produces a neurotransmitter called norepinephrine. Other parts of the world call it noradrenaline, and I mention this because many of you have more of an intuitive understanding of what adrenaline is. So normally, that part of your brain is producing a normal amount of norepinephrine, and it's sending it to different parts of the brain that regulate things like breathing, heart rate, blood pressure. So right now, I'm awake, I'm speaking to you, my blood pressure's normal, my heart rate's normal, I'm breathing, things are functioning as they should. If I were to use an opiate, there are mu-opioid receptors on the locus coeruleus, and what happens when an opioid binds to this part of the brain is it depresses the production of norepinephrine. So you're depressing a neurotransmitter that keeps you awake and breathing. So what happens when you use an opioid, that decreases and you get the physically sedating effects of an opioid. If you use too much, then you're in a state of overdose. Your breathing can stop, your blood pressure can drop dramatically, your heart rate can stop. And as we all know, that can be fatal. If you're in that state, you need Narcan or naloxone immediately, and we will talk more about that at another time. But when you have a person with opioid use disorder, which means they're using opioids regularly, and they're regularly suppressing the production of norepinephrine, the body likes to maintain what's known as homeostasis, which is balance. So when you are regularly depressing the production of this neurotransmitter, the body is going to compensate and try to raise that back up to a normal level. So we're overcompensating and we're bringing back up our norepinephrine to a normal level. So again, we can function, we can be awake in the presence of an opioid. So what has happened now is that person is now dependent. And what happens if you remove the opioid, you have this increased production. If you remove the thing that's suppressing it, your norepinephrine levels shoot out the roof. And what that does is it causes GI distress, sweating, insomnia, anxiety. You have an opioid withdrawal syndrome, and that's how that manifests. And we use medications like methadone and buprenorphine to partially address what happens in that phenomenon. So again, the point of this is to distinguish that addiction and dependence are quite separate. They do influence each other, but dependence occurs in a completely different part of the brain in addiction, and that's just part of the understanding of the difference between the two. So, thanks for watching.